Peace, peace. YouTube, welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Neville Riley. Welcome, YouTube. So, we pick up in chapter 13, page 300 or 219. Peace, YouTube. Welcome, everyone. All right, episode 37. Bottom of page 219. Metaprotenol, alupent, metaprel. Metaprotenol is the most recent aerosol bronchodilator to be introduced into the United States market. The drug has been used in Europe for many years and has proved itself a useful agent. Although as much less powerful bronchodilator than isoproterenol, it has a more prolonged effect. At the present time, metaprotenol is available in the Freon cartridge and orally, but is not available in the liquid form for inclusion in IPPB therapy. Although metaprotenol has less beta 1 effect than isoproterenol, it is not a pure beta 2 drug. Salbutamol and terbutaline. Both salbutamol and terbutaline are drugs that have been used in Europe for several years and have proved to be superior bronchodilators. They are pure beta 2 stimulators and are effective by mouth as well as aerosol. Metabolism is much slower than with isoproterenol, and therefore the effects are significantly prolonged. These are not presently available in the United States for aerosol administration. Decongestants. Racemic and epinephrine. Microferrin and vapoferrin. Racemic and epinephrine is a mixture of the levo and dextro isomers of epinephrine in a 50-50 proportion. Compared with epinephrine, this agent has little beta or alpha effect. However, in aerosol, it is a good mucosal decongestant. The beta 2 effect of the drug is mild, significantly less than isoproterenol, but the effect is prolonged because of the mucosal alpha effects. Topical alpha stimulation causes mucosal vasoconstriction, and this is the prime value of the agent. It is an effective aerosol decongestant. Clinically, racemic epinephrine provides a near perfect routine additive to IPPB nebulization in the presence of tracheobronchial inflammation. The drug is an effective topical vasoconstriction, a mild systemic bronchodilator, and a drug which has an extremely low incidence of cardiovascular side effects. It must be emphasized that this agent is a mild bronchodilator and is not the agent of choice when severe bronchospasms are present. Peace, YouTube. Highest heart love. Thank you so much for being here and reading with us. We are in the thick of it, right? So, clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. And this is the peaceful place on YouTube where we read books and learn from masters. So thank you so much for being here with us. We're at page 220. All right, here we go. Racemic and epinephrine is commercially available in a 2.25 or 2.25% solution. It is administered as a half milliliter of the drug in 3 to 5 milliliters of dilute. It may be repeated as often as every hour in the adult. The occurrence of cardiovascular side effects is rare, but when they occur, they are the same as those for epinephrine. Phenylephrine and neosepinephrine. Is an alpha drug often used in conjunction with beta stimulators. Solutions of 0.25% to 1% may be administered in IPPB nebulizers, a half milliliter diluted with 3 to 5 times no more than each hour. Mucokinetic aerosol agents. Mucus is composed of protein and sugar molecules bound together in extremely long chains. These mucopolysaccharide chains are bound to by amino acid and sulfur bonds. The sulfur bonds are known as sulfhydryl bonds. When mucus is extremely thick and viscous, breaking the mucopolysaccharide chains create smaller molecules that are less viscous. Hypoviscosity agents. Water and weak electrolyte solutions reduce the viscosity of sputum by diluting the mucopolysaccharide strands. The appropriate aerosol delivery of weak electrolyte solutions is by far the most effective of all the mucokinetic agents available. Sodium bicarbonate makes the mucus alkaline. This tends to decrease its viscosity by making the amino acid bonds less stable. Detergent agents have been used in the past for IPPB therapy. They have proved to be no more effective than water or sodium bicarbonate. Peace, highest heart love. Thank you so much for reading with us and the likes and subs. We're pushing towards now 1,000 subs. I'm so grateful and thankful. This is amazing. Like my dream completely come true. Reading books here on YouTube for free, giving you thousands of dollars worth of information. And, we're pushing towards 1,000. And so, man, this is another one for the playlist. This is beautiful. Thank you so much. Glycerol and propylene glycol are sometimes used to stabilize aerosol particles. Ultrasonic nebulizers have erased the need for addition of hygroscopic agents such as propylene or glycol. Propylene glycol. Alcohol is an agent that decreases surface tension and will theoretically decrease viscosity. Its use in respiratory care is the best limited to pulmonary edema as a defoaming agent. Mucolytic agents, pancreatic dornase or Dornavac is the most popular enzymatic mucokinetic. It is a particularly effective proteolyte enzyme digesting the deoxyribonucleic acid. That's DNA. There you go. You already know. Peace be. Highest heart love. Much love. Peace, Australia. Thank you so much. We are on page 221 now. Look at this. Oh my goodness. Much love. Mwah. Peace. Look at that. We identified in the 1979 book. There it is, right? Deoxyribonucleic acid, DNA, present in purulent sputum. It has little effect in non-purulent sputum. And acetylcysteine, or also known as mucomis, is a chemical substance that destroys sulfurhydryl bonds of mucopolysaccharide chains. It is an extremely effective mucocolloidal agent. It will act on non-purulent as well as purulent secretions. Wow. Wow, that's deep. Acetylsalicine is administered in a 10% solution and has a very low incidence of bronchospasms. However, we still recommend that it be given with racemic epinephrine. Steroids. Steroids are known to be potent topical anti inflammatory agents, and it is only logical that they be tried in aerosol therapy to decrease tracheobronchial inflammation. Evidence indicates that there are a little steroid absorbed systemically but with properly administered aerosol. The prime systemic absorption of aerosolized steroids comes from swallowing the medication. Aerosolized steroids should never be a replacement for adequate systemic steroids. We believe that the primary use of aerosolized steroids is an adjunct to systemic steroid therapy, aspiration, pneumonia, or glottic edema. In circumstances where chronic lung disease patients are steroid dependent, adjunctive aerosolized steroids may decrease the need for systemic steroids. Dexamethasone or decadron is the most widely used steroid compound for inhalation. Usually, doses are a half to 1 milligram in 3 cc of diluted per IPBB treatment. Page 222. Thank you for the likes. Thank you for the subs. Highest heart love. I know this is so deep, right? It's so, yeah, super high level. Vocab. Thank you so much. Being in a peaceful place on YouTube where we read books and learn from masters. I wish that all of you are in good health. This is the place where we uplift one another. Light workers unite. And that's what we're doing here, reading this work to the public so that, we can heal ourselves and heal our friends. That's what we do, that's the good life. Like to be able to heal ourselves when we're sick or to actually help others when they are sick. That's doing the work, right? I see the hearts. Thank you so much. That's doing the work. That's what we do this for. Someone has to do it. I'll proudly take it on, right? I know the vocabulary is crazy, but masters are going to be mastering. That's how it goes, right? That's what we always say. Antibiotics. Chapter 13, at the end of chapter 13, page 222. There we go. Angel numbers, and you're in the house of the angel, and you are an angel. Here we go. Antibiotics. Antibiotics have been widely used in aerosol form for the treatment of pulmonary infection. It is doubtful that there is an advantage to this route over systemic injection, and its use has precipitously diminished. Antibiotics work best by systemic absorption, and there is no evidence of a decreased toxic effect when administered by the aerosol route. In addition, there is evidence that certain antibiotics topically administered may increase the incidence of sensitivity reaction to that drug. There is little rationale for the use of antibiotics in aerosol therapy. And there it is. Completion of chapter 13. We did it. Highest heart love. Thank you so much, V. Thank you to all my mods, all my friends and family, all the book readers in the book lovers community. We're doing it, step by step. So, when we reconvene, we will go into chapter 14, which is clinical application of the bronchial hygiene therapy, which is so masterful, right? The application is why we're all here right now, you know, to learn to apply the information. That leads us to wisdom. Clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Oh, thank you, beautiful brother. Amen. Thank you so much. Oh, much love. Oh, I love you so much. Thank you, Teddy. Highest heart love. Man, we're doing it, right? The light workers. We're here. So, all right, let's breathe. Let's breathe together. Here we go. Respiratory care. so thankful, grateful for all I have now and all that's coming to. So thankful for all my friends and family, all the beautiful people. Love to the King's Gambit and Liz, and all the September 15th, 16th birthdays. Happy solar return to the wonderful mother, Norma Kiara Blake, the mother of Isis, Kayla, Michelle, Riley. We did it together. That Virgo energy is so strong. I love you. Thank you. Love you. I love you. I love you. Love you. Wow, it's so good. I love you. Thank you so much for breathing with me. Thank you for reading with me. I want you to have a wonderful evening. We have done it again. We completed another chapter. All right. So when we reconvene, shaking it up on YouTube, reading medical books with super high vocabulary, we will reconvene in chapter 14. Thank you so much for breathing with us and loving on us. Thank you for all the hearts, likes, and shares. Happy Monday. Beautiful, beautiful Monday. I love you. I love you. You know I do. Oh, thank you so much, V, for keeping the chat clean. All right, so I love. I will see you soon.